Hello students, this is Amrita and today we'll be discussing about the electrotherapy subject, like in terms of the exam, how to present the subject and how to write the answers, how to like get ready for the exam and everything. Some tips and tricks as well. So before learning about the tips and tricks, let's just understand the breakdown of the question paper. I'll just share my screen with you all. Yeah, I hope my screen is visible to all of you. Yeah. So basically, to start with, in the electrotherapy, just like every other subjects, we have four essays. Okay, out of which only two has to be answered. So in the first question of the essays, you will be having two questions, out of which one is choice. So whatever question you know, you can start answering with it. Same implies for the second question as well. And then coming to the shots, you have you have eight shots to answer. Okay, each contains 5 marks and the essays contain 10 marks. Okay, and then you have very short answers, like the VSAQs, which are 10 in number and everything constitutes of 2 marks. So you are supposed to answer them. Just remember one thing, you only have choice in the essays, you do not have choice in the very short answers or in the short answers. Okay, so remember that whenever you're writing the exam, you should have this in your mind, because so many students, what they do actually, when they're writing the essays, because they have choice in the essays, they think that there is choice in the shorts as well. So they try to, like leave one question or two questions thinking that there is choice or something. Okay, so don't get confused. Okay, the choice is only there in the essay questions. Okay, now besides that, like on the screen you can see some of the essay questions that were asked in the past in the exam question paper. Okay, now how do you actually present, or how do you actually attempt every question that's asked in the exam, like some tips and tricks or like whatever. See, I'm not going to talk about the basic tips and tricks, as in, like carrying some basic instructions, like carrying your hall ticket, starting with whatever you know. There are some quite basic things. Okay, you have already written your 10th board exams, you have written your 12th exams. At this point, you have even written your BPT first year ka exams. So it's quite basic. Whenever you are starting an examination, always you have to start with something you're very good at. Let's just say you know all the shots better than the other two headings, like the essays and the very shots, then go with the shots. Okay, or let's just say you're very good at the VSAQs that have been asked in the question paper, then start with the VSAQs, or same implies for the essays. So whatever you're starting, there's no need to follow the pattern that's present in the question paper. You can change the pattern, you can start with any of the things that you know, but just make sure if you're starting with the shots, finish off all the shots, and after finishing all the shots, start the very shots and then the essays. So everything should be segregated properly. Do not write like first you'll write a short followed by an essay followed by a VSAQ. Now if you write like that, obviously the evaluator whoever is there, he gets frustrated, and whatever, let's just say you've written the correct content, but then because you have frustrated the evaluator so much, he'll not give you any marks. Okay, that's quite basic, but still I just want to tell, because there are some students who does that kind of mistakes. Okay, yeah, so ignoring that aside, now let's just say a question is asked, a modality is asked in the question paper. And I'm so sorry, before that, I just want to tell you that you all know electrotherapy has two papers. Okay, you have paper one electrotherapy, you have paper two electrotherapy. Paper one may you have the low frequency and medium frequency currents being asked along with the basic science or the basic physics. Okay, and in the electrotherapy 2 paper, you will be having the high frequency modalities being asked. It's like the high frequency and the low frequency. So most of the students, as far as I have, like inquired, and as far as the information that I've received, and also including my personal information, everybody faces a great difficulty when attempting the electrotherapy one paper, because lot of basic physics will be asked. So now how do you attempt this paper? Now how do you remember the basic physics and everything? Starting with the modalities, remember whatever the modality is, let it be a low frequency modality, medium frequency modality, or a high frequency modality, there is a certain pattern that you're supposed to follow, which will make the evaluator understand that you're very clear about this modality and you know everything about this modality. So it makes sense giving you full marks, is what the evaluator thinks. Now, what is this pattern that I'm talking about? First, always start with the definition of the modality. Okay, for example, tense is being asked. Okay, tense was asked in your question paper. Start with the definition of tense. Now, once the definition of tense is done, then go with the mechanism of action. Like, how does this tense work? Now, talking about tense, you have a gate control theory, which is the actual theory behind the mechanism of the tense. For every modality, there will be mechanism of action. So, right after the definition, write the mechanism of action, okay, or the mechanics, whatever the modality works accordingly. Okay, after that you have the types. If at all in tense we have different types of tense, so you can mention about the different types of tense or different types whatever the modality has. Okay, then go for the technique. See, most of the students, what they do is they do not write the technique. Okay, only for few modalities, like few techniques, like for example say ionto forces or phono forces, they write the technique. But for other modalities, nobody actually writes the technique. So it's very important to write the technique. So in the technique, what are you supposed to write? Start writing the technique from the basic. Okay. Imagine that the patient has come to you, and the patient that has come to you is supposed to be given the modality, whatever is asked in the question paper. In this case, tense. Okay. Now a patient has come to me. I have to give him tense. Now what I'll do? Firstly, I'll see the area wherever the treatment has to be given. Start from there, start from the basic, right, as it is, like write in this manner only in your exam paper. Check the area of treatment. Based on the area of treatment, what position you want to give to the patient. Is it supine, sitting, or is it prone, or is it side lying, whatever. Just keep the heading as position of the patient. Okay, and then after positioning the patient, what do? You have to clean that area of treatment, cleaning the area of the treatment. Then placing the modalities. What pattern of the modality, like what pattern of the placement would you choose? Mention about that. So mention the technique very clearly, because this technique itself contains a lot of value whenever you're talking about a modality. If you are very good at writing the technique, that means that you are very good at that utilization of that modality. I hope you're getting my point. Okay, so write the technique very clearly from the start till the end. Okay, it should start from placing of the electrode to removal of the electrode. It should be like that. Okay, or cleaning of the area of treatment being done to cleaning of the area where the treatment has been done. Okay, it should be like that, start end. Okay, that's one thing important. Now after the technique, what you're supposed to write? You're supposed to write the parameters. Every modality has its own parameters. Okay, you have different intensity levels, you have different time levels, depending upon the acute stage what time you will be giving, what depending upon the chronic stage what time or what intensity you have to give. That's really really important. So remember the parameters. I know a lot of numbers get involved here, but then we can do nothing. We are reading a subject like that which involves a lot of numbers and formulas and like physics and everything. So bear with that. Try remembering all the like parameters and put the parameters. Firstly, the technique will give a good impression on you if you if you write it in the answer paper. Followed by that, if you write the parameters, now the evaluator is 100% like decided that yeah, you know the answer. Okay, okay, so that's how you're supposed to write. Then there is one most important thing about every modality, that is indications and contraindications. Now, you people might be thinking that what so much in indications and contraindications. Everybody can write it because most of the contraindications are same. You'll have the implants as contraindication. You have open wounds as contraindication. You have infection as contraindications. Most of the contraindications for the modalities are same. But if you just put the heading as infection is a contraindication, or let's just say swelling is a contraindication, or whatever, then you might not get good marks. Okay, for the evaluator to understand that you know the answer better or you know the subject better, what you're supposed to do is you have to explain why the particular thing is a contraindication. For example, most of the students, like I have actually like seen one of my students paper. He has written that tens may the contraindication, he has written as implants. See, tens is a modality where that deep penetration wouldn't be seen. So even if the patient is having implants, like you can go for tens, of course, based on again the area, you can like go for it. So that's very important. So when you're putting an implant as a contraindication, write why that implant would be a contraindication for that modality. Ultrasound, you're giving ultrasound. Now if you write that contraindications may there is implants, then you have to mention that when we are giving ultrasound, ultrasound is a deep heating modality. So when you give a deep heating modality, the heat will penetrate deep down, and the metal, whatever is there inside the body, it might catch the heat, and then it might lead to internal burns. So that's quite basic. Besides that, if a patient is having infections, why is that infection a contraindication for that modality? Mention about each contraindication. In the same way, indications. If you are writing that one particular condition is an indication for one particular modality, explain why or how this modality can treat the the indication or the condition rather. Okay. Now again, see, when I say this, students think that they'll have to write like so much about that contraindication or so much about that indication or whatever. See, do not, complicate it. You barely have 3 hours in your hands to attempt the entire paper. And one worst part about the medical field on a whole is, if we are asked for one question is one chapter. Like tense is a chapter in our, textbooks. So obviously, when you want to put everything in this chapter into the question paper, it will be very difficult. So do not waste putting over information in the paper. Okay, this happened to me when I was doing my UG. Back then the rehab paper and the SPM paper was so easy. It was so easy that I wanted to write everything that I knew in the paper. Okay, like let's just say, in the question paper they have asked me only, like they have given me one thing, and in that one, like architectural barriers is there. Like final year students will be understanding this. Let's just say a question of architectural barriers has come, and he has only asked me definition. Because I know the answer very good, I wanted to put everything about the architectural barriers in the question paper, in the answer paper, sorry. I wanted to write its definition, the condition wise architectural barriers, why architectural barriers are important, lots of stuff, and I ran out of time. Okay, so that's one thing that I faced. So you people don't do that mistake. So whenever the question, like, whatever the question paper, like whatever the question is being asked in the question paper, answer it till that part only, because in the question paper we'll be having divisions. Okay, like for example, if you just see in this question paper it is missing, I'm so sorry, but then usually if you just see any question paper, there will be breakdown of the answers. Okay, for example, if you see the second question over here, I'll just highlight it. Never use this pen tool, but I'll just try to be a techie here. Okay, yeah. For example, just look at this question. Here they have asked you to define the IFT, okay, and explain its principles, physiological, therapeutic effects of IFT. So whatever the 10 marks being given for this question, it will be a proper breakdown between all these things that are being asked here. Here, four things he have asked: definition, principles, physiological, therapeutic effects. Four things. So under these four things, or for the four things, the 10 marks will be divided equally and it would be given. In some question papers, what happens is they'll directly give you a breakdown like 2 plus 3 plus 4 plus something. It will be like that, and total is equals to 10. It will be something like that. Please excuse me if my math was wrong, that 2 plus 3 plus 4 is equals to 10. I know it's definitely wrong, but then, like, we are not talking about maths right now, we are talking about electrotherapy. So leave that aside. Right. I hope you're getting my point, what I'm trying to say. I hope you're understanding what I'm trying to say. Right. So yeah, now in this case here he has asked me definition, principles, physiological, therapeutic effects. Now what I will do in the answer paper, I'll write the definition. Okay, I'll write the principles, I'll write the mechanism, I'll write the parameters, I'll write the indications and the contraindications. Abhi, I'll not write the physiological and therapeutic effects. Now, what the evaluator will do, because you haven't answered the therapeutic and the physiological effects that was asked in the question paper, he will not give you full marks. Okay, whatever the marks are allocated for the physiological and the therapeutic effects will be cut for you. Okay, I hope you're getting my point. If you want to write or if you want to give over information just to justify your answer, first answer the questions that have been given in, like, that have been asked as part of that question, and then give the extra information. Do not skip the information that the question paper has asked. Okay, I hope you're getting my point. Okay, in the same way, if you see the A part question, here they have asked what is a condenser. Okay. Then they have asked charging and discharging. Oh, I'm so sorry. Right. So they have asked charging and discharging of the condenser. Now, if I write what is condenser and if I don't write what is the charging and discharging of a condenser, then the evaluator wouldn't give me marks. Like he wouldn't give me full marks. Whatever the marks were allocated, they will be like cut off for this thing. So that's why read the question very clearly. Most of the people, what they do is they do not read the entire question. Instead, they very cleverly just read the topic that they've asked. In this case, they'll only read IFT and they'll think that, yeah, I know about IFT, so I'll write everything I know about IFT. It's not about, see, every time just remember, it's not just about the electrotherapy exam. Any exam, it's not about writing what you know. It's about writing what they've asked. So that's why read the question properly. Read what he's asking about IFT. Is he asking about the mechanism? Is he asking about the condition or the parameters or the indications and the contraindications? Focus on that and then attempt the answer. Okay, right. And one more thing while attempting any modality, one thing I just want to tell you is always write a case. Okay, that's a very good thing. If you have seen Jagmohan book, I know many people would come at me if I say Jagmohan because everybody is against Jagmohan, but but for cases it just gives you a very like precise manner of case presentation. It gives you a case and how the modality would help you to treat the case, what would be the electrode placement, what would be the parameters and everything. So put a case something like that. That will give you some good or extra marks. Okay, that's always a good thing. Okay, see, leave about the marks. If you just exclude marks from here, in the future, in a practical way also, it's very like useful for us. Okay, right. So that's one thing. So that's about the essay. See, the major problem comes with the essays only because from every topic you would ask some certain set of things in the essay. So you will have this problem. So check or thoroughly read the question paper. Once you receive the question paper, just go through it for some 5 minutes. It's not at all wrong to read the question paper for 5 minutes. Okay, I personally suggest everybody to like go to the question paper very well, because once you understand what the question paper has, then you can like go with the flow. Okay, I hope that makes sense. Okay, right. So now coming to the shots. See, shots are like these things that are very clear about their future. Like shots may they'll just ask you one word or two word ka thing, where there's no need of like putting so much effect into, and you can just write what they have asked. Okay, in for example, here in this case they have asked about accommodation. What is accommodation? Just simply you can write that if you just give a same intensity to a patient for a prolonged period of time, the currents would be, the patient wouldn't feel any change in the like currents, because it's flowing in one ease flow, and then there is no ups and downs in the currents, and it's just one flow. So there will be accommodation. So what you're supposed to do, you're supposed to like change it. You are supposed to ask the patient if he's like feeling the sensation of current being flowed or etc. See, I'm not here to discuss every question that's asked here. I just want you to give you tips about the exam. The reason why I do not want to talk about every question that's in the question paper is these topics, whatever are there in the question papers, they have been already discussed in the exam modules. Okay, like in detail video lectures of these along with the notes and MCQs and everything whatnot are in the exam module. So if you want in-depth lectures about every question in the question paper, I recommend you to like go to the exam modules, like subscribe to one of the exam modules, the second year exam module, and go through the video lectures. That will give you a better understanding about every question that's asked. Okay, here I just want to only tell you about the tips and tricks, some shortcut tricks for you to pass or to reduce the tension that you're having because of the exam, if that makes sense again. Okay, right. So that's about the shots. Now coming to the very shots, again same very shots. See, sometimes what happens is when I'm talking about the very shots, I just want to make this clear. Basically, sometimes the essay questions, the questions that are usually asked for essays, sometimes they would be asked for shots. Now, like very shots, not even shots, very shots. So in that cases, what the students do is, I don't know, they just get overexcited or something. They just try to put, or they just think that the evaluator wouldn't notice or something. They just put the entire information about that question, like they write some 2, 3, 4 pages ka answer in a very short. Just because a essay was asked for very short, just give too much information. Remember one thing: if you write 4 pages ka answer, or if you write 2 pages ka valid, or two lines or 3 lines ka valid information in very short, they are ultimately going to give you 2 marks only. Just because you have written 4 pages ka data, they wouldn't give you some 4 marks or 5 marks for a 2 mark question. Remember that. See, students are clever, evaluators are much, they are like much sharp, so do not try to bluff them or cheat them. Okay, right? So that's one thing. Do not do that. And also one more thing, not just if a essay question is being asked for very short, but in general, very shorts are supposed to be like extremely short. That's what the name says. Okay, brief notes. Okay, so as the name suggests, do not give a lot of information. Okay, just try giving a very minimal information about that. He's asking you to, there is this thing in Telugu. I don't know if you all know it or not. It's called as katte kotte teche. It means like the shortest thing. Like, you're not supposed to give a lot of information into it. You're supposed to just give the important valid points, the principal points of it. It's something like that. Very shorts may you're only supposed to write the important points only, not everything. If he's asking you something, then just straightforwardly give the answer to it. Do not start from its history or introduction or whatnot. Okay. So ultimately he'll give you only 2 marks. Remember that. Don't waste a lot of time for very shorts. Okay, so 10 marks you will get here in very shorts. So mostly in half an hour you should be able to finish the very shorts, not more than half an hour. Okay, if you think that you're very good at all the very shorts that they've asked and you're very confident with the answers, then start with the very short answers only. Then go for the shorts and essays. The reason why I'm telling this is basically essays are so lengthy. So once you start with the essays, what happens is it easily takes some 1.5 hour to attempt the essays. Okay, if you start with the essays, 1.5 hour will be gone for just 20 marks. Okay, just for 20 marks, 1.5 hour will be gone. Again, the remaining mark, whatever are there, like 60 marks, whatever are there, you are supposed to manage the 60 marks questions in the remaining 1.5 hour, which is like a lot of partiality going on over here. Okay, so that's what you're supposed to do is give more time for the questions that give you a lot of marks, like very shorts and shorts. Start with very shorts, go for shorts, and last may you go for essays, because by the time you finish, like, see, there's simple logic. You might be thinking that even if I start with essays or the shorts, I'll be left with the same amount of time. But there will be a relief under you. Okay, whenever you're starting the paper with a question in the beginning of the examination, everybody would want to give a lot of information starting me. When you're going to the end, let's just say 2 hours ho gaya, or 2 hours are done, 1.5 hour is done. Now what you try to do in the remaining time, 1.5 hour, you try to like brief everything out. You do not want to, you cannot draw the diagrams, you cannot like do the proper labeling, you cannot draw the circuits and stuff. So do not put yourself in such a situation. That's what I'm trying to tell you. So once the very shorts and the shorts are done, you can contribute all your time for the essays. Okay, you can write till the end of the paper, till the examiner pulls out the paper from your hand, you can write. So it's like that. Okay, so that's about the electrotherapy 1 paper. Electrotherapy 2 paper is also very very similar. Okay, they will ask you some modalities. Okay, remember always, whenever you are writing a modality, now every modality, we cannot draw the modalities. And to be very honest, every modality looks similar to one another. Like for example, there is TENS, there is IFT. Both the machines look similar. Okay, Abhi, you cannot draw a square box and some wires and some electrodes and write IFT TENS on that. That is time waste. If you do something like that, the evaluator will understand that this person is just trying to kill the time. Okay, because anybody who knows about the subject, anybody who knows everything in the paper wouldn't do such a simple mistake. Drawing diagrams is very good habit, but then remember or just make sure what diagrams you're drawing in the question paper. Is it useful or is it useless? If you draw the useful diagrams, you'll get marks. If you're drawing the useless diagrams, what the person will think is, the evaluator will think is, he'll think that you know nothing and you are just there to pass the time, the 3 hours ka time. That's why you're simply drawing the diagrams. Okay, and now you might be getting a question, ki where should we actually draw the diagram? See, here in this case, if we talk about the electrotherapy, in the electrotherapy, there are different types of hot packs, cold packs that we have, not hot packs, cold packs that we have. So each cold pack would be of different shapes and sizes that you can draw. You have SWD, SWD may you have different types of, like the electrodes that you can draw, the spacing in the SWD that you can draw. That kind of diagrams can be drawn. And besides that, I have already told you, write about one case for every modality. Okay, like for example, you are writing tense answer, and in the tense you have written the condition low backache. Now just draw the area of low backache. Just don't complicate it so much. Just draw it like this. I know the diagram will come out to be very, very, very bad, but for your better understanding, I'm drawing it. Anything I'm doing, it's just for you people. So don't make fun of my diagrams, okay? Right. So just draw back something like this, okay? And then just draw the electrodes like this. If you're going for two electrodes or if you're going for one electrode, okay? Sorry, not one electrode. If you're going for two electrodes or if you're going for four electrodes, just draw it properly, okay? Say. So you can draw something like this, and for every electrode, you can, just put the wire something like that. Okay. So this is how you can write for IFT. Okay. You have chosen the, like condition as low backache. You have placed the IFT electrodes and everything. So this is important. This is a valid diagram. You are showing the placement of the electrodes. That is valid. But then if I'm trying to, like draw a square box like this, I'll just put some buttons here as well. Okay. I'll just put some buttons and I'll just write IFT over here. Does this does this make any sense if I just draw something like this and happy I'll just draw a wire? This is bullshit. Not the evaluator. Leave about the evaluator. Even your friend laughs at it if you draw that kind of diagrams, okay? Right. So that's one thing. Okay. So draw only diagrams wherever it is necessary. And also, whenever you're writing the protocol, like for example, I've told you that technique, you have to write the technique. So whenever you're writing the technique, instead of putting all the information together in the form of para, just write it in a flowchart manner. Step one, step two, step three, step four. You can write like that. That makes, like, that will give a more clarity. There will be good visibility, hence you can get some good marks. Okay. Again, in the electrotherapy 2 paper also, you will have 4 essays, out of which you're supposed to write 2 essays. First and second question will have choice, so you are supposed to pick one question whatever you know. Again, I'm telling you, just read the question properly and answer whatever is asked in the question paper. Here they have asked about IRR, okay, and here they have asked about types of generators, physiological and therapeutic effects. These are the mandatory things that you're supposed to write in the answer paper regarding the IRR. Besides that, if you are writing something useless, they'll not give you marks, okay, or they are not going to give you extra marks. First write this, and if you think writing them would give you some better marks, then go for that. Okay, right. So that is that. Then here, yeah, see, there will be questions like these. These are the most, mischievous questions that, just misguide us. Here, if you see, they have asked about ultrasound. So when we see, ultrasound used to be my very favorite question and favorite modality to use when I was in BPT. So if I was a student in BPT and if I see this question paper, first I would read this ultrasound and full I'll become very kush. I'll not read the production of ultrasound. I'll think that maybe he's asking about the technique or the pattern or whatever. I'll start drawing the diagrams and I'll start writing about it and stuff. But I'll not write about the production, because production of ultrasound is little difficult when compared to the other stuff that's in the ultrasound. So what I'll do, I'll not write about the production. I'll write about all the useless stuff about ultrasound. It's useful only, but according to this question paper, that is useless. Okay, I'll put all that stuff. Now, what the evaluator will do? He'll give me 0 marks here. 0. I'll fail. I'll think that I have written everything in the question paper, what's wrong. But if I just check the question paper properly, he has asked me about the production of ultrasound. He didn't ask me about, like the treatment method of ultrasound, or what are the parameters of ultrasound or whatnot. Okay. So that's one thing. So check the essays clearly. I'm telling you this again and again and again. Essays can mislead us in a very worst way. Okay, right. So don't just see the modality that they are asking, just check what from the modality does the examiner wants. Okay, right. So that's one thing. And coming to the shots, and see here he has directly mentioned spacing of SWD. Besides writing the spacing, if you write something else, it's useless again. Okay, so short and very shorts are like, like straightforward. These people are very straightforward. They ask you whatever they want. Again, you have some 8 shots, each contains 5 marks. So here you will be having 20 marks. And in the very short questions, you have 10 very short questions, and then you will be assigned 2 marks for every very short, and then it's a total of 20. So my suggestion again, when you're like starting the paper, start writing with very shorts followed by shorts, then essays, because essays like kill a lot of time. So I do not want you people to waste a lot of time. And particularly the high frequency paper, the electrotherapy paper 2 is very lengthy paper. Okay, so every question that's in the question paper is like very long questions. You do not have small questions, they're like very long, like the ultrasound or the SWD. They're like very lengthy questions, they have so much information in them. So that's why go for it. Okay, right. So I hope some of these tips and tricks you would implement in your exam, and you would give a good try, and you secure good marks in your exams. Again, I'm just telling you, I do not want to discuss any questions that are present in the question paper, because the questions have been discussed in detail in the exam modules. If you want, then go by the exam modules where we have the notes, we have the MCQs, we even have the mock test papers. Once you are done studying one subject, you can just go through the mock test paper. It will be same like the exams ka question paper only, main exams ka question paper only. So it will be like, see, that will help you to manage the time and everything. Just before the exams, it's like a test trial. Okay, right. So go for that. All the best for your exams. Thank you.